Welcome to the Skill Dynamics podcast. This is procurement and supply chain expert conversations that matter to your business. I'm your host, Alan Falk. With me today is Renaat Vandenhoff. Has more than 35 years of global operating experience in a variety of healthcare businesses. And until early 2020, Renaat was CEO, president, and member of the board of directors of Temptime Corporation. And currently, he advises private equity companies and serves on a number of boards, including Clinical Minds, Parcel Shield, CSafe, and Covectra. So Renaat, welcome to the show.
Thank you, Alan, and happy to be with you today.
So our topic today, cold chain. There's a number of things I know we'd like to cover specific in the pharmaceutical industry, but if you would start us off on just very basic, what is cold chain?
Well, first of all, we need to mention that in pharmaceuticals, most pharmaceuticals used to be small molecules. And with the new millennium, there was a new trend of biological pharmaceuticals. And the positives of biologicals are that they are therapeutic advancements and really bring cures for formerly incurable diseases. But the downside is that they are temperature sensitive. And that brings additional challenges for manufacturing, storage, handling, and shipping. So managing the temperature of these products is often referred to as cold chain management. And that starts with the manufacturing process, sometimes with the active ingredients. It goes through the whole supply chain, every step along the way, and it ends with what they call the last mile, which is, how the product gets to the hospital, the pharmacist, the doctor, and ultimately to the patient. And cold chain management wants to track and trace that whole supply chain and make sure that there are no cold chain breaches.
Mm-hmm. The public is becoming more aware of cold chain than ever. Cold chain is almost a household phrase right now. As we record this, we're in the part of the pandemic of COVID vaccines being released. I wrote down a couple things as far as like Moderna and Pfizer. Just the temperatures are anywhere from -20 to -70, but they have to be transferred within so many days, stored so many days, thawed, and have to be delivered in so many days. So the importance of cold chain has become almost like this household topic.
Which is actually great. There's a laser on it. And it's so important, Alan, because, what happens if there are cold chain breaches is those medications, and now, of course, COVID vaccines are in the spotlight, they become less effective or maybe totally ineffective, which means that you can have a false sense of security being immunized with a vaccine that's not effective at all. So you think you're protected and you're not. And the complexity of the COVID vaccine is a good example. Like there are differences in where they need to be stored frozen, for how long they have to thaw, how many hours or days they can be in an unfrozen state. For healthcare professionals in that last mile, it becomes like a nightmare on how to track it. Mm-hmm. So obviously, what is important ultimately is how you track and trace these vaccines or any other biological through the cold chain to make sure that at the end of the road, before you immunize the patient, you have a final checkpoint on whether that vaccine or that drug is still effective. There has been no temperature breach.
In preparing for this, you shared a story NBC did. The title of it is "Millions of Americans Receive Drugs by Mail, but Are They Safe?" Speaking of cold chain breaches, this story came out December 8th of 2020. But I'll read a little excerpt from the story, which is the NBC News investigation found the growth of mail-ordered pharmacies has caused many people to feel trapped in a system that has left them with crushed pills, damaged vials, and life-saving drugs exposed to extreme weather. There's a quote by Georgia State Representative Ron Stevens. He said, "If they're sending it without a temperature strip and you're the recipient of insulin or a life-saving drug, you're taking your life in your hands." This is cold chain has serious consequences when it's not truly moved, stored, and managed in the right way.
The consequences are indeed that patients, that was a great example of a specialty pharmacy. They're sending drugs to patients. Their quality of life entirely depends on the quality of the drug.
Mhm.
If the drug has been temperature exposed, the quality of that drug has likely been diminished, therefore less effective. Therefore, that impacts directly the quality of these patients. Unfortunately, and this is what this uh, documentary brought to light, is specialty pharmacies don't always use these temperature indicators to accompany the mailing orders of those drugs to the patients. Some do, some don't. There is no legislation, there is no regulation in this country. Actually, there's no body, no regulatory body that looks after the cold chain. The FDA doesn't look after it, the CDC doesn't look after it. It's nobody's responsibility. So it basically depends on the distributor or the manufacturer to decide whether they will use the right techniques and tools to ensure the right delivery. And because there's no regulation, it all depends on the companies. Just some do and some don't. And that's why it almost becomes an ethical question next to a business question for these companies.
Mhm. Yeah, there is an ethical responsibility, just like the story is shared. There's additional people that were interviewed, mothers, with their kids saying, basically, I'm my nerves are on edge every 3 months when the new, insulin comes or whatever. And there's so much responsibility that's put into that. So what would be your advice to these individuals that are within manufacturing companies that are looking at their cold chain process?
Well, first of all, you have to want to know. You have to have that discussion in your company, whether you're a distributor or a manufacturer. And what I found uh, when I worked for Temptime, and we were basically marketing and selling temperature indicators, is some companies want to know and want patients and doctors to know, and some just want to stick their head in the sand. And if there's no regulation that mandates them to use these techniques, they're not doing it.
Hmm.
And obviously, if something goes wrong, these drugs should be discarded, but there's a cost to it. So that's where the business issue comes in, is who's going to be responsible for bearing that cost. But you know that when the patient is getting a drug that's been temperature damaged, the quality of life of that patient is going to be hurt. So I think my advice would be the, the issues have to be discussed openly as a company, and it's an ethical question. Is, a lot of companies say in their mission that patients come first. Look at healthcare companies. Their mission always is patients first, patients first. I would urge companies to have this mission on a slide and project it when you're having these cold chain management discussions, and truly make sure that the patient come first when you have that discussion.
Mhm. Yeah, sound advice. 2 points I wrote down is that these issues must be discussed openly, and that this is an ethical question, and that with the mission of patients first, that should be presented first as well in doing that. I think kind of a closing thought on this would be uh, for those that want to take steps towards this, discuss it openly, and realize this is an ethical question. What would be some of the first steps they should take towards doing that?
Well, they should evaluate the cold chain of the products, where they are responsible and even where they are not responsible. Like the manufacturer, it's easy for them to discuss and say, hey, we're just making sure that we're taking care of the legs that we have immediate accountability for. Um, you know, Making the product in our plants and shipping it to the distributors, to the McKessons, the Catalans, and the AmerisourceBergens of the world. But their responsibility in a way goes further. It goes, they have to make sure that the product is still authentic and is still temperature safe when it gets to the patient. And they should have that discussion along the whole spectrum and make sure that they try and cover more bases than what they are directly responsible for.
Solid advice. Evaluating cold chain, I think many people will stop within their sphere of influence. What is it they directly manage? But what you're saying is this entire spectrum, even where their responsibility doesn't lie, look at the entire cold chain and ensure that the ethical responsibility is all the way through.
Exactly. And then have conversations with those other partners along the way of the supply chain spectrum and hold them accountable for making sure that the product gets to the patient in the right way. Because ultimately, what matters is that patients get the right products that have not been temperature exposed. That's going to impact their quality of life. And ultimately, that is what we are in business for in the healthcare industry.
Renaat, great conversation today because cold chain oftentimes is just looked at from the moving and storing of items. It's very logistical, and I like what you're bringing up today. That cold chain also has an ethical responsibility. Without the body of regulation around it, there's more we can be doing with the conversations, who we're holding accountable, and how we find responsibility in that cold chain. So thank you so much for bringing this to our attention and for allowing us to have this conversation. And my hope is the people listening to this today take you up on your advice, which is they will evaluate their cold chain, the entire spectrum, have these open conversations, present this ethical questions of patient first, and ultimately hold accountable the people responsible to making sure that this cold chain is a safe, ethical responsibility for the entire company. So thank you so much.
Thank you, Alan, for the opportunity today. Thank you.